We're taking this, 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 we're taking with a pinch of salt.
Ladies and gentlemen, welcome to another episode of A Pinch of Salt, a podcast by ERA devoted to you, our dear listeners. We're trying to ask simple yet clinically relevant questions and provide you with simple yet clinically relevant answers. My name is Andrej Koberné. I'm a nephrologist from Slovenia. This episode will be slightly different because we have the honor and the privilege of having amongst our midst not a physician, not a nurse, but actually a patient. Also, somebody who's been a caregiver for another patient and somebody who unfortunately has also firsthand experience with kidney disease herself. Our guest today is Malene Deele. I'm sorry if I mispronounced the name. She studied law at the Copenhagen University, did various jobs after that, but then when she became too sick, she of course had to leave that particular profession. Now she's the chairman of the Danish Kidney Association and is very involved in programs of helping other patients cope with their disease, particularly, I guess, dialysis patients and transplant patients where it's most difficult. So we really wanted to give you a patient perspective because I believe we as professional physicians, medical professionals, we are somewhat in our own worlds. I find myself often looking at symptoms as diagnostic clues, how they help me to diagnose disease, much more than something that I should help the patient to get rid of. It sounds ridiculous, but that's how I sometimes feel, that I forget about the actual problem and are more focused with my job. So we're very happy to have her with us today. Malene, welcome to A Pinch of Salt.
Thank you.
Maybe we can start off by explaining how you came into the field of kidney disease, your personal first-hand experience. How have you arrived into the position you are now?
Well, I think it was, I want to give something back. So I had this education and I saw a lot of my peers having, being without jobs, having difficulties, having a normal life. And I thought that now I was living a normal life and I had a job. I thought I would give something to my peers. So that was when it started in 2012 that I was just going into the Danish Kidney Association because I thought I had a lot of knowledge. And also I thought that the most difficult thing is the loss of empowerment when you are diagnosed with kidney failure. And I think that it's very important. And even then, I thought it was very important to say, well, what do the patient want? Even when they are very ill, what do they want? What makes them happy? What makes them thrive? Because if it's only about the disease, it's very difficult to hang on to life quality. So
Yes.
that was my way in to the Danish Kidney Association. I wanted to try to do something that more people could have more life quality and more empowerment.
Yes, definitely. Very important. So when did you first discover that you yourself have a problem with the kidneys? And when you did, what were your initial thoughts and fears and questions? How did that affect you?
Well, it didn't affect me the first time when I was 7 years old because I thought everyone was having dialysis, and I was greatly surprised that other children didn't go to dialysis. But then I was transplanted for 20 odd years. And when I came back, I have a career. I worked in the treasury department and had just bought my own apartment. And when I got the diagnosis that now you're in kidney failure, it was like, wow, if I lose my work, I lose my apartment. If I lose my apartment, do I go back to the country and live by my mother? And my mother is this crazy, loving person, but I wouldn't be codependent. So I felt like I was very afraid of losing everything I had, everything. So I think that was terrifying for me. And because I could remember how it was to have dialysis when I was a child, I was very afraid of dying. I hadn't thought that has happened a lot in 20 years. So of course I wouldn't die. But that I didn't thought at the time. So I was very afraid. And I was very afraid of being codependent of other people, and that I needed to sell my apartment and what should I do? So I think that was that was one of the things that was really difficult for me to find out how to keep a normal life, how to keep working, because I wanted to keep working. And I think that my savior in this was that a nurse and a doctor who said, well, you just need to come to Hemmer. You just need to learn how to put a needle in your arm, and then you just get it home. And I was like, but I fear needles.
Yeah.
So that wasn't a great idea. And I remember, and well, now it's many years ago, so I can share it, even though I don't think other people should do the same. But I was very afraid of needles. And then they gave me some needles with me home when I had my fistula. And I went by my table and I just pinched myself and tried, because I had it like, I don't want any nurses, any doctors. I want to figure this out myself, how I get to needle my fistula. And it succeeded. And the next time I was at the hospital, they say, oh, wow, you're good. Well, I practice at home.
Oh my God. That's quite extreme, but good for you. Good for you.
Yeah, but anyways, it did that. I could keep my job, and I could keep my apartment, and I did have dialysis at home, simply.
Wonderful.
And now I have it like one of my good friends says, well, you wouldn't have any of your friends brush your teeth. And once you have laid your own needle, you
Yeah.
wouldn't dream of anyone lying that needle. You would do it yourself.
Yes, I can imagine. Yeah. It
Yeah.
seems to me that this transition to dialysis is such a difficult one because it affects your life so significantly. And I often wonder what we as doctors could do to help in that transition. I sometimes feel that because we don't have our personal experience of what it is actually like to be a dialysis patient, it almost kind of seems to me that you would need a help from another dialysis patient. It's much like if you take, for example, getting healthy from addictions, which is also a very difficult psychological thing. They had
Yeah.
figured out, like in Anonymous Alcoholics, it's very important to have another person who has gone
Yeah.
through it. What do you think? Is that essential, or can we as doctors or nurses do something as well?
I think both things is possible. I know that in the Danish Kidney Association, we have something called a dialysis body, or kidney body, which means that some couple of years ago, I saw or I heard through the internet a lady that was just so scared. She was going to her first dialysis, and she was so scared, and she was sure she would die under the first treatment, and she was really very much in anxiety. And at that time, I found a match for her that have been through, and I let them talk and said, well, maybe you two can go to this person's first dialysis. And that was really the beginning of a dialysis buddy, that we have a corps of people that have been in different kind of dialysis in different kinds of situations, and feel they like to give something back. And you can meet up for a cup of coffee at a cafe, or you can meet at the hospital at the first dialysis. But I also think that doctors and nurses can do something, because we need to be honest when the kidney is not working as well, and when the symptom burden is big. I think it is important to talk about what are the possibilities, and also how are your everyday life? What kind of dialysis would be suitable for the life you have now? I was happy that somebody said that, well, you can go to work and then you can have your dialysis in the evening. I thought that was a help. So about somewhere between the doctors, the nurses, and maybe the patient organizations, it would be nice that we kind of said to them, what life do you want, and how can we plan the dialysis, and how can we do it maybe so you're not very bad when you come in dialysis, but maybe you have possibility to understand more, so you're not that polluted when you start. So maybe start also dialysis a bit earlier.
Yes, that sounds. I think that the idea of the dialysis buddy is extremely important. So, if I may ask, how many people approximately in Denmark are dialysis buddies? How many people do you have doing this program?
Well, it's just in the beginning. So I think we're about 15 or 20. So it is mostly, it's spread all over the country. And they can go out and get a coffee. We also have a hotline with people that you can call and ask questions to, that are donors or patients or informal caregivers. So if you are one of those things, you can call in and talk with someone that have been in a similar situation, and that helps. We also, at some hospitals, people are paired up in a way that the new ones can visit the patient's home. I had some patient with me when I had dialysis for 2 years at home. They asked if some of the patient that was newly started, if they could come home and see how I live with dialysis in my home. And I said, well, of course. So the idea about peer-to-peer, patient to patient, and also sometimes ask the patients that have been going on dialysis for 3 years or 4 years, let them see how it's working for them.
Yeah.
Yeah.
Yeah, I think that's amazing. I think many people would need that. So, how was your experience? How did dialysis and your disease affect your relationship with your family and close ones? Because I think they also suffer quite a lot when their loved one becomes a dialysis patient. How did they take it? How can we help them actually get through this?
Well, I think that I think that most of my family is understandable for it, and kind of just rooting that everything will go well. I think if I look back, I think my mother has when I was a baby, she was like hands on. And now where I live in my apartment and very grown up, 46 years, I think she worries quite a bit, and also anxiety and crying, and she's very like, oh, what happens now? And you need to tell me everything. And every time I tell her everything, she's like really sad. And there isn't any really support system for that, I think, because it's such an acute situation, and I think that every family needs to have some kind of support, and that I don't think we have a lot of in Denmark. We sometimes have it through palliative, where you can talk with a psychologist or so on, but I don't think we are so good at in the acute situation. It's very difficult where people are very afraid.
Yeah, for sure. And you've also mentioned the job and the financial aspects, because these can be horrible. If you look at the data that is actually published, and even if you look around our own dialysis centers, you will notice that there's a very disturbingly large number of people who are actually living in poverty. getting some kind of some money from the state, which is usually terribly low. And I've seen patients who were malnourished just from financial issues almost. It's terrible. I don't think we're doing enough for that. What's your impression?
I think that we are lucky in Denmark. I think we could do more, but I think in Denmark we have this system where you can work and get money from your employer, and then the state will accumulate it up to 37 hours, or how much a normal week work is. So we are often do we have an okay salary because we have a good social system. But I think it's very different in the different countries how the social system is going. And I will say that many people like to work, but many employers don't think it is very nice to have one that only works maybe 7 hours a week.
Yes.
And I think that is a problem. It's been a problem in Denmark to tell that we have a working force that is cheap because the state pays some of it. And I think an awareness about that 7 hours, maybe you have some odd jobs, it would still be good for the patient to come out and do something, because you also get isolated when you haven't got any work colleagues, or you very fast get very isolated. And I think that's a problem also.
Yeah, for sure. And anxiety that you've mentioned already, depression and loneliness, in my mind, these are the three biggest enemies of the patient with kidney failure. And how do we address that? Do you have any programs, psychology programs for dialysis transplant patients that would address that? Because these three things are potentially treatable also. And how do you see that the work being done in these situations?
I don't think the job is being done, to be honest, not even in Denmark. I think that sometimes we are lucky in the Danish Kidney Association that we can take some in, and we have money to give to psychologists. So, but I see a big void where there's a lot of people that have anxiety, and it's like it is so special to be a kidney, to be a doctor or a nurse. It's so specialized that
Yes.
that you think a lot about the kidney, and the psychology part you don't take in. And actually, it is very much how you thrive and how you live your life, because it's not only your kidney you need to look at in dialysis. You also need to look at the mental state, because we have seen incidents where people are not taking their medicine, people who don't come to their dialysis because they have a bad day or they want to sleep. And it's very difficult because we don't have a program I think sometimes they are said, well, dialysis is a thing you can choose or don't. So, okay, you choose not to go to dialysis. And I think that's a bit cheap because it's human lives. And we have clinics in Denmark that has with, or what do you call it, diabetes. Where we have a center where the diabetes patients that have psychology problems are coming, and then they are making a plan for them that are how to regulate their diabetes and how to look out for their psychology. So they have two ways of looking out for the patients. And I'm a very strong speaker for that. We needed something like that in the Danish kidney area, that we have something that both take care of the psychic and also take care of the kidney. So it's not just looking at the kidney, but looking at the whole person.
Of course, yeah. And another issue that is usually also very confusing for kidney patients, especially ones who have just come to dialysis, and also something that makes them anxious often, is diet.
Yes.
The terrible issue about diet, all the possible restrictions and suggestions, it's quite confusing, even if you have learned about this yourself. So what's your approach to diet? How do you approach this problem
Well,
of fluid and potassium and everything?
I think that I'm very much feeling my body for the first. So the first thing is, if I look at at water, too much water, I think it's often looking at both my legs and keeping up how much have I drank and how much have I peed, so to speak. And I think that that is my little. It's a little thing you always have in your head, or I always have in my head. How much have I drank, and how much have I peed, because I still can pee. So I think that's the one part. And if it's phosphates and kaliums, I'm trying to say to myself that I must not be afraid of eating.
Mm.
But I look at my blood tests, and then sometimes I also talk with a dietitian. But somehow, when you have lived with this in many years, it's like, you know, the small things you need to avoid or have a little less of. So for me, it's kind of, I eat mostly what I want. Now I have too low kalium, for instance, because I still pee in dialysis. So now I enjoy chocolate and bananas, but but,
Amazing.
but you know, but you know that can change. So I think I'm very much into my blood tests, actually, and feeling
Yeah.
my body.
Yeah.
And I
I
can actually feel if my kalium is a bit too high or too low. I
yes, I've
can
heard
feel my
that.
phosphate.
I've heard that many times, that people get attuned to their body, that
Yeah,
they feel their potassium, their kalium,
yeah,
and the water. So you just have to be in touch with yourself, I guess, and
yeah,
figure it out along the way, right?
yeah.
So you seem to have had a very, I would say, successful, meaningful, beautiful life despite all of these health issues. And so, what's your secret? How have you managed to be so successful, I would say?
I think that what has always driven me has been that I don't want to survive. I want to live. I think it's very important that if you have something in your life you love, and at one time it was my career, now it's something else. But to remind yourself when you're really ill what really makes me happy, and cling on to that. And maybe you can't have 10 things that makes you happy, but maybe you can have 3 things that makes you happy, and then cling to that. So I'm always about, when patients say, oh, I can't travel anymore, I'm getting too old, I'm getting too ill. I say, well, are you sure you can't? Are you sure? Because the Danish Kidney Association also arrange travels where everything is planned, and they just need to go to a hotel, and then they go forth and back in a taxi, and there's a lot of possibilities. So sometimes it's like you think you can less because you are ill, and you make some boundaries that's not really there, but in your head.
Yeah.
So I think it's very important to the final good advice I have always lived by is, what do we really care for, and grab onto it.
Yeah. Yeah.
Yeah,
That's important, even if you're not afflicted with a very difficult chronic disease, I guess.
exactly.
Yeah. Yeah. So we've mentioned a lot of problems that people with kidney failure face. But of course, we're also interested in solutions. So you've mentioned one that is really important, that is on the side of the patient. Continue living your life, right? Not just existing, but living, I
Yeah.
guess. But what do you think that we, as nephrologists, as nurses, might do better to help you with your challenges? What do we need to improve? What's the solution? Three of them, perhaps, or a couple of
I
them.
think I will remember what one doctor said to me some time ago. And he said, "What do you want in your life? And I will try to support you on the health side, reaching your goals." And I think that was a very nice thing. And I wouldn't have been reading at the university if he hadn't said that. And he said, "Well, how can I help you on the health side to support you to make your goals? How can I help you? What are your goals? What do you want for your life?" And I think that when you once is asked what is important in your family, it's very different. It can be that an older lady say, "Well, I just want to see my grandchildren once a week, but I'm too tired." Well, let's try to organize it so you can see your grandchildren once a week. I think it's all about asking the patient, what do you want? What is important for you? And how can we help you reach the goals? And sometimes the goals are not realistic. And then we can talk about that. But if you have a goal, try as a doctor or nurse to say, well, how can we help you health wise to get to that point? Being walking, or being having a little job, or something like that. So you kind of have this this hand in the bag where you support the patient in having a normal life, and
Yeah.
having. Of course, we always talk about symptoms and the illness, but maybe we should talk about, yes, you have this illness, but what possibilities do you have to do what you really want to? Because else you're just existing, and that's not good.
That's not good enough, right?
No.
Yeah, I like what you're saying, because of course, also saying to the patient, what do you want, kind of forces them to activate themselves, right? Because
Yeah.
sadness and despair will lead you to become passive, and then nothing good happens. So maybe it's also one of our jobs to kind of wake up the patient,
Yeah.
force them back into life, so to speak. Yeah.
Yeah.
Okay, thank you for this, for
Mm.
these pointers. I think we have to think about these things, because at the end of the day, we're there to help you, right? It's what we
Yes.
want, even if we don't always know how to do it, but it's what we want. So the last question is more of like a getting to know you type of question, and it's which book, two songs, and luxury item would you take to a desert island?
Oh, that was such a difficult one.
Yeah, I know
Well,
everybody complains about this one, but the answers are very revealing and interesting. They have been so far.
yeah, I think that I did think about it, and I think I'm an old soul, very old soul. So I really like Shirley Horn's "Here's to Life," because it celebrates life, even though it casts a lot of things against you. She sings about "Here's to life" and to celebrate life, and I
Is
like
that a
that.
song
Yeah, it's called "Here's to Life" by Shirley Horn.
by Shirley Horn? Okay, I haven't
Yeah,
heard it. Yeah,
it's it's an old American singer. And sometimes when I'm a little sad, I always hear that song, because it kind of reminds you that even though life is hard, it's worth celebrating that you are that you are alive, even
yeah,
though yeah, life keep coming at you.
that's what music can do for sure. Yeah,
Yeah, exactly. And then I only think I got one book. It's W.H. Auden, Collected Poems, and It's called Musée de Beaux-Arts, and it's about Icarus' fall from the sky,
Yeah.
and how the whole world are just going around, and they don't see the tragedy in this boy falling from the sky. And sometimes when you are at the hospital and you see everyday life passes by, you kind of have it like Icarus, that life, normal life, is passing you by, and you're not a part of everyday life.
Yeah. Yes, of course, I can imagine that. Yeah.
Yeah. So that's one of my favorite poets, because I think it's very revealing in telling also about the loneliness and pain of being a kidney patient, that you sometimes feel that life just passes you by, and you can't really be a part of it. And I think that in that poem, I think it's from 1936 or something. I mean, I think it's a very modern poem that is very tell about how suffering can be when you are alone and you have your disease. So I think that's also a poem I often go to when I need to order my thoughts.
Yeah. I guess it probably sometimes can feel like you're invisible to everybody else in a way, right? It's
Yeah, because you look like everyone else, so why aren't you like? And I remember at the university, I didn't have a lot of strengths, and I remember that you sometimes felt odd because you went to bed before all the others, that you
yeah.
need to study harder, and it was like, but you couldn't see anything. You couldn't see that there was anything wrong with me. So I think that loneliness that sometimes is in being a kidney patient is important to know it is there, but also to snap out of it, and I do that. But sometimes you do feel the loneliness of the illness because people can't see it or understand it.
Of course, yeah. And what about your luxury item? What is the luxury item you
Oh,
like?
luxury item. Oh, I'm so much in doubt. I don't know if a dog is a luxury item. I love my schnauzer. I would
If it's
bring
not a
her.
luxury item, it's very good to have with you, of course. Yeah, we'll take the dog for sure. Yeah. Dog is good.
Yeah.
Okay, great. So we've covered all the major questions we wanted to ask. Thank you very much. We're very
Thank you.
grateful. I think people will learn a lot from this, from your experience. I
Thank you.
think we should try to get the dialysis buddy program to in every country. I think it's very important, and we should try to ask our patients, "What do you want?"
Yes, exactly.
Okay, thank you very much for this. Thank you.
Thank you. Thank you.